today joining us, we have a wonderful guest from GE. Can you introduce yourself?
Hi, my name's Luke Delaney. I'm the general manager for our automated breast ultrasound business at GE Healthcare.
Great. Today I was hoping we could spend a little bit of time talking about leveling the playing field for women with dense breasts and the screening strategies that are appropriate for them. Could you talk a little bit about the sites that you've seen that are rolling out programs specifically for women with dense breasts?
Yes, traditionally women get mammograms when they're 40 years or older annually. And what we found in the last 10 years, even longer, is an understanding that women each have a different level of breast density. And what we know is that women with higher breast density have both a higher chance of having breast cancer from a fundamental risk perspective and a higher chance of having their breast cancer missed. So programs here and around the world are both using tools to quantify breast density and using supplemental screening tools like automated breast ultrasound to try to improve sensitivity in finding breast cancer in dense breasts.
Right. What sort of methods are you seeing for triaging women for supplemental screening to ABUS, for example?
Yeah, so traditionally breast density is categorized into 4 categories, BI-RADS A, B, C, and D. And categories C and D are considered to have dense breasts. And so most sites really do triage between A and B and C and D. A and B are considered non-dense. They get standard mammography or tomosynthesis as their standard of care. But for patients with BI-RADS C and D who have dense breasts, usually supplemental ultrasound and more automated breast ultrasound is a tool that they're using to find more cases.
That's fantastic. Are you seeing any moves in using these triage methods, these supplemental screening methods to drive personalized care?
Yeah, I mean, once you decide to do something about dense breasts, it's very important to understand who has dense breasts and how to help them understand what they should be doing. So solutions like Volpara and using quantitative breast density measurements, it allows a systematic way to help women understand what their density is and to help triage those patients to supplemental screening.
It sounds like it's the right suite of tools and solutions, from risk assessment that includes breast density to the right screening model to genetics, all coming together for what's best for the patient. Are you seeing a lot of interest in your customers in looking at full-scale solutions?
Yeah, I mean, once you go on the journey of personalized breast cancer detection and personalized medicine, you really see all of the individual problems. Understanding a woman's risk, both because of density and other factors, understanding what are the right tools to do based on those, based on that risk profile. So it really is a perfect marriage of all of the different tools.
Sure.
Detecting who should get what test and then making sure those tests are as good as possible in finding breast cancer.
I would imagine that consistency is a really important piece of the strategy. So you want to personalize it, but you want to deliver consistent quality, consistent image. Is that something where you see ABUS excelling?
Yes, screening is a large-scale endeavor, right? And in order to give breast cancer screening, personalized breast cancer screening, to tens of millions of women in the U.S. and hundreds of millions of women potentially, you need a systematic way to identify who needs which type of test, and you need automated tools to find more cancers. So all of the technologies, both in understanding breast density, in understanding personalized risk, and in imaging, are becoming more systematic and more automated.
Right. Well, thank you for sharing your perspective. I really appreciate you.
Yes, thank you for having me.